Welcome to the Sweaty Pillow podcast. We have a very special guest, and I was just looking back at all of our podcasts in a year and a half, and for some reason, I'm not sure why, but we've never hosted a man. So this must be a very special man today for us to welcome him into the Sweaty Pillow. And he certainly is. We've got Dr. Bill Bruno, who is a board certified plastic surgeon based in West Hollywood. How exciting and exotic. And a very famous and well-known plastic surgeon. But why we're talking to Dr. Bruno today is the pioneering integration of longevity and wellness into modern medical practice. And you've got this prescription for longevity and healing and prevention and thriving at every age. So we're dying to get into the conversation. Welcome, Dr. Bruno, and thanks for joining us today.
Oh, thank you for having me, Larry. I appreciate the opportunity.
I was intrigued in doing the research and then so fascinated when we got on a call to discuss your work and the genesis of sort of what happened in your own personal health journey and what led you to this new body of work. So tell us everything about what you went through.
Yeah, about 8 years ago or so, on a routine blood test, I found out I had elevated cholesterol, which led to some tests like a stress test. And then I myself requested another test. It's called a coronary artery calcium score, or CT calcium scan. And that was very elevated, which is a sign of heart disease. And then based on that, it led to a CT angiogram, which is another heart study where they inject dye and it gives you a really good look at the vessels of the heart. And essentially this led me down a pathway of adopting like an almost vegan lifestyle. And I really took a deep dive into nutrition and sort of lifestyle ways of, dealing with cardiovascular disease. I was very reluctant to get on a statin at that time. I didn't want to take any medication. So I made a lot of lifestyle modifications, and that was really the beginning of it. And at that time, as a doctor, I didn't really know, as doctors aren't really taught this much about nutrition. What can I do on my own with lifestyle measures to sort of manage, or could I even, halt the disease? Could I have disease regression? And then I got another CT angiogram about a year ago, and I showed that, yes, it has been stable for these 7 or 8 years. So that's kind of the story of my journey. And along the way, I started sharing a lot of the tips and advice and strategies with my plastic surgery patients when they would come in just for consultation, or if they were getting ready for surgery pre-op, and I would look at their blood work and I would notice they had a lot of abnormalities as I did, but they weren't getting any counseling from their primary care doctors or their internal medicine doctors. So I sort of felt obligated as a physician to sort of help them with that. And I started doing a lot more social posts on wellness and longevity, and really kind of went down that pathway to where I am now. And I created a digital course on wellness and longevity to try to reach more people, and have a coaching program on wellness and body recomposition, mostly using lifestyle measures and only using medications, I think, in certain cases if someone has, like, for example, really high cholesterol that can't be controlled with lifestyle. But that's a little bit about me. But, my regular day-to-day job, I'm a plastic surgeon. I'm in surgery every day operating, and I do the coaching and the wellness sort of in addition to that, because I think most people need it. And I think most people aren't getting the answers from their primary care doctor. So if I can help in any way, I feel it's my duty to do so.
I love that you've connected, you're practicing as a plastic surgeon, but you seem to be very focused in and passionate about beauty from the inside out and what we can do to improve just our overall health and well-being as we age by focusing on lifestyle. And I think it was an interesting stat that you told me on the phone around the percentage of improvement on the quality of your life and the risk for heart disease or cancer is 70 to 80% if you change your lifestyle, that you can have an improved quality of life.
Yeah, I think most people are under the impression that their genetics sort of control their lifespan and how long they'll live and what diseases they might get. And the reality is, yeah, maybe genetics contributes about 20% to that, which leaves you, the patient, or us as patients and people, about 80% of our lifespan, health span is under our control, and we can control that with the food we eat, the movement that we do, the sleep we get, how we control our stress, and how we live our lives. So, I think a lot of people, they just feel they're stuck with the genetic cards they were dealt, so to speak, when the reality is that's not the case. There are some genetic diseases that the familial hypercholesterolemia, for example, you're born, you have really high cholesterol, but that is a really small minority. And I think the message I would reinforce to people is no matter what age you are, no matter where you're starting from, you can improve your health by making these small changes each day, by each decision you make, whether that's what food to eat, how much exercise to do, when to go to bed, what time to wake up, all those sorts of things you have direct control over. So I don't want people to think that, they're just at the mercy of their genes, because they're really not. You have a lot of control over this, and to try to teach people to be proactive and, go to your doctor with questions and maybe get some blood work done on your own and bring these results to your doctor and try to really collaborate with your doctor. And if you're not getting the right answers, maybe seek out, a functional medicine physician, maybe an integrative medicine physician. The traditional doctors like myself with, Western allopathic medicine doctor, I think we tend to treat symptoms more and don't get to the root cause of things. And it turns out the root cause of most of the chronic diseases that are killing people in America, which is heart disease, type 2 diabetes, dementia, and cancer, a lot of that is avoidable through lifestyle. So it's not necessarily, medications that are required. So that's sort of the message that I think people should sort of take away from this, is that you are in control of your health. And if you can influence 80%, that is very significant.
It's remarkable to me that there isn't more innovation in the medical community on getting ahead of, in terms of prevention and asking for or initiating more tests early on before it gets too far and you're dealing with the symptoms. So do you see that pattern changing for our children's generation?
I think so, because I think now with the advent of, there's more like at-home blood testing tests that you can order. There are even services where you can sign up. For example, I use a service, it's called Life Force. I have no affiliation with them, but this is a company that will come to your home, come to your place of work, draw your blood every 3 months, and then you'll review those results with a physician via telemedicine. And I've been using that for 2.5 years, and that's almost serving as like my physician, so to speak. But I think getting the blood work done using a number of those types of services and or using at-home blood testing kits, and the popularity of those, along with certain, at-home genetic testing kits and et cetera, I do think the next generation will be more proactive with regard to their health and not be as reactive as we are now and as people have been in the past. I think most people only go to the physician once they have a problem. And in some cases, that might be too late, like with certain cancers that are detected later stage, for example. Whereas hopefully the younger generation, I think they are getting that message and they are being more proactive about their health, and they are seeking out testing, or they're seeking out answers a lot sooner than they would just wait to see that doctor once a year and they'll say, well, your labs are normal, see you next year. Sometimes it's not sufficient. So I do think that is changing.
So I wanted to get into the specifics of, what you recommend for folks, but I also want to connect it back to our community, which is women navigating perimenopause and the menopause transition and the unique things that we go through as women. So can you just give us a rundown of the important either tests or questions to ask their primary care physician, and what route should we go down to get all of the really the necessary answers that we need?
Yeah, I think, men and women, not necessarily just with regard to menopause at the moment, but the number one killer of women and men is heart disease in this country by far. So I think as far as for screening tests there, the basic lipid panel that people get is probably not sufficient. I would maybe ask for an expanded lipid panel. One of them is called the Cardio IQ panel. One is called an NMR panel, where basically it's telling you not only what your LDL and your HDL cholesterol is, but telling you the number of particles that you have and the size of the particles that you have. This is very important, as these are predictors of heart disease, along with ApoB, which is apolipoprotein B. And I think as far as blood tests, I would certainly start there or request those, because your primary care doctor is not going to run those routinely. Related to that, I alluded to the test before. I think a coronary calcium scan, I think anyone over 40, male or female, should look into getting a coronary artery calcium scan. Although it's not covered by insurance, it's reasonably cost effective. It's about $200, I would say. It involves no IV contrast. It's basically a CAT scan through your heart, and it'll tell you if you have the presence of heart disease, hardened plaques, which are calcified and firm. If you do, like in my case, then the next test above that is a CT angiogram, which is now, there's a test out there called a Clearly scan, where they'll inject dye into your blood vessels, take the CAT scan of your heart, and then they'll superimpose AI over these images so they could tell you what percent blockage you might have in certain blood vessels of the heart. Now, that might be for someone who maybe has a history of heart disease or might even have some symptoms or has a positive calcium score. But because heart disease is the number one killer, I would focus there. With regard to menopause, to I know a lot of your audience, I would certainly say after menopause, you're losing out on the protective benefits of estrogen. Estrogen is a very strong anti-inflammatory. So a lot of things will happen in menopause. Cholesterol will start to go up. The risk of higher rates of heart disease go up. Blood pressure tends to go up because there's less nitric oxide. The blood vessels become a little bit stiffer. So what you'll see in the menopause population could be, whereas men might see more heart disease in their mid-50s, women who might go into menopause 50, 55, they'll have more onset of heart disease 10 years later, maybe 60, 65, and 70. So by losing that protective effect of estrogen, definitely I would seek and look into hormone replacement therapy. Now, I think a lot of people do not take hormone replacement therapy primarily because of the Women's Health Initiative that came out in 2002. And this is a study basically that was at the time saying that hormone therapy is bad, it can cause breast cancer, et cetera. That study has been reevaluated. And I think now in 2025, I think most people would look at that and say, well, there's a lot of value in hormone replacement therapy, not only in alleviating symptoms of menopause, but for longevity benefits. I think what we don't know quite yet is how long to be on it. Where do you end that? Do you take it till you're 70? Do you take it till you're 80? I think that's a gray area. And I think finding a good practitioner, whether that's OBGYN, internal medicine, or endocrinologist, or even going to the Menopause Society, is a place to look to find a good practitioner to help treat those symptoms. Because, and not to just talk about the heart so much, but also for the brain, you're losing out on these benefits, and women are more likely to have dementia. Obviously, there's the bone loss component that comes with losing estrogen. So women in the first couple of years of menopause can lose 20 to 33% of their bone mass. So there are lots of other benefits beyond just the heart. I know I was focusing on heart disease there, but in particular for the menopause, perimenopause, menopause population, I would strongly at least have the conversation about, is hormone replacement therapy right for you? I think there's value in that for sure.
I really appreciate you breaking down the test protocols that we need to walk in with our list to our primary care physician and or seek an alternative doctor if they're not supporting us through this. Now what do they do? They've had these tests. There could be indicators that are concerning. There's higher risk factors. What then do people go do about changing their life?
Yeah, I think if someone, if they have a specific issue, like whether it's cardiac, whether it's more metabolic, like type 2 diabetes, or they've had a family history of cancer, they have issues, they need to go down each of those, say, avenues. With cancer, for example, anyone over 50 certainly is at higher risk of cancer. And there's two things they could do. I would look at getting a blood test. It's from a company called Gallery, and it can screen for 50 different types of cancer, things that we're not normally screening for, not like typical breast cancer or colon cancer or cervical cancer. And also consider a full body MRI over the age of 50. That's going to screen for cancers that can potentially be detected at a very early stage where they're treatable. With regard to the metabolic diseases, hemoglobin A1C, again, that's another blood test. It's becoming more popular, but, checking a fasting insulin level. If someone needs it, being on a continuous glucose monitor. These are ways to evaluate how you react to certain foods and the rise in your blood sugar and the rise in your insulin levels accordingly. But, back to your question, I think what most people could do or should do is focus on the basics. And, I would sort of view this as, okay, what can I do every day with my nutrition, my exercise, and my sleep? Starting with nutrition, try to eat mostly whole foods. Try to avoid ultra processed foods. Try to make single ingredient foods the bulk of your diet, at least 80% or more of your diet. Try to make most of your meals at home where you can kind of control those ingredients and avoid some of the more dangerous, let's say, vegetable oils, seed oils, the deep fried foods, things of that nature. People always ask, like, what's the best diet? And that gets into a very, passionate conversation sometimes. But I would just say probably the most widely accepted diet would be the Mediterranean diet from a heart health standpoint. And again, emphasizing whole foods there, trying to optimize protein, I would recommend for most people. Trying to shoot for about 1 gram of protein per pound of ideal body weight, especially as you get into the perimenopause, menopause years, because most people begin to lose muscle mass. And this relates over into the next component, which is exercise. I think certainly resistance training needs to be emphasized at any stage you are in life, whether in your 30s, 40s, 50s, or beyond. Weight training, at least twice a week, in addition to some low steady state cardio. And then maybe once a week, you're doing sprint training, which is very good for, bone density along with the resistance training. And the one area I think most people neglect is sleep. Sleep, I think, is foundational for wellness, for preventing certain diseases. And I think trying to, get, somewhere between 7 and 8 hours, but try to create a great sleep environment at home, meaning using the bedroom not for eating, not for watching TV, but just for sleep, creating a cold environment, a dark environment, a quiet environment, and working on your habits. Going to bed at the same time and waking up at the same time, even on the weekends, is probably the most important habit with regard to sleep. And other things like cutting out on your screen time, like no phones, tablets, television, hour or two before bedtime. And if you do have to use those, use like a blue blocker eyeglasses. I've been using that for years, where it's like a yellow or orange or even red tinted glasses that cuts down the blue light that's coming from the tablet, because the blue light's going to significantly cut down on the melatonin. It's going to make it harder to fall asleep and harder to get quality sleep. Trying not to eat too close to bedtime too. I would try to put at least 3 to 4 hours between the end of your dinner and bedtime. But I think those are the foundational elements, I would say, would be the nutrition, the exercise, and the sleep. And then getting the right diagnostic tests at the right time. I mentioned the cardiac testing, cancer screening, some metabolic testing and the like, and then kind of narrowing it down. I don't want to necessarily get into supplements, although we can. I think those are sort of icing on the cake. People are like, what about cold plunge? What about, hot saunas? And there's value there in all of these things, but focus on your sleep, focus on your exercise, focus on your nutrition. That is the bulk probably of your longevity and how well you're going to live and how long you're going to live.
Those are the pillars of health, are they not? Just sleep, fitness, and what you're putting in your mouth.
I would say so. And I think if we spent more time optimizing those instead of worrying about the next IV infusion or the next red light therapy or the next hyperbaric oxygen, I think we'd be so much healthier as a country. And I think that's where people get distracted and sometimes reach for the next interesting, exotic treatment, injection, or supplement, whereas you can get so much more done on your own. Like, for example, getting morning sunlight. That's going to help set you up to better sleep in that evening. So it's funny that your sleep actually begins in the morning. Getting early sunlight in your eyes sets you up for a good night's sleep. So in things like grounding, that's free. Going outside, having your feet in the ground, in the grass or in the sand, getting these electrons, negative electrons into your body, that's very anti-inflammatory, but it's going to set you up for a better night's sleep. So it's almost like these more ancestral, primitive things to do, like spending more time outside in the sun, barefoot, actually will make you healthier. So it's not necessarily technology that's making us healthier. It's just getting back to a more simpler life.
I saw Andrew Huberman on Bill Maher on the weekend. I recorded him, and he was most passionate about getting morning sunlight, like pedantic about it doesn't take a lot of minutes and you can't be behind glass and you can't have sunglasses on. Like, he wants us outside looking kind of in the direction of the sun. And it really took me by surprise on how important that was to his philosophies. And now hearing you say that is really interesting.
Yeah, I think, light is becoming more and more understood and its impact on our health. And not only getting that morning sunlight, but also in the evening, blocking out the harmful blue light. Most of us, we're in an office all day and then we get home and we have this unnatural blue light that's on, whether it's their TV or light bulbs. And really, when the sun goes down, you should either switch your light bulbs to red light bulbs, let's say at home, or put them on dimmers, the orange, red light, and wear the blue blocker glasses that I mentioned, because it's really going to cut down this harmful blue light, because that's what's, as a society, I think, really disrupting our circadian rhythm, and it's affecting our sleep. And when your sleep is off, as you know, this affects your whole next day, and that affects you're probably going to make poor food choices. You're probably not going to want to exercise. So they're all sort of interrelated. And I think, yes, light is like almost viewed as a nutrient, I think, to some of the experts now.
It's really helpful because when we talk about sleep here at the Sweaty Pillow and in our work at Lucime and being so connected to women's health and women in menopause for 12 years, that's a symptom that women wrestle with the most and they're really angry about. And they credit poor sleep to all the downstream horrible things, as you say, causes weight gain. We're just not going to make healthy choices. We're exhausted, the stress and the strain of it. So, emphasizing sleep and the things that we can do without resorting to prescriptions, natural ancestral habits, I think are really helpful. Can we circle back a little bit to, you mentioned something about a glucose monitor and insulin and sugar. What role is that playing in disease?
Most of the chronic diseases we have, some would argue, are due to insulin resistance, which is basically like type 2 diabetes, where someone might be making enough insulin, but it's not working. And then your body has to make more and more insulin. This high level of insulin leads to, a whole host of disease, leads to some cancers. It exacerbates cardiovascular disease. I think what's become popular with regard to the continuous glucose monitor some people are doing this who aren't even type 2 diabetics. It's a small little disc, maybe the size of a nickel, and it goes sort of usually on the back of your arm, your shoulder area, and it senses your blood sugar. So let's say you have a meal and you can see on your phone, it's connected via an app, it'll tell you how high your blood sugar goes and for how long it stays high. So you could say, for example, oh, I had this really high reaction to a certain meal. Maybe it was a really, high glycemic food. It was a, you know, uh, high glycemic, bread or a pasta meal. And you can see how high and for how long your blood sugar stayed high, and then you can make changes to your diet. Now, I don't think everyone needs to do that. Some people might do it for a couple of weeks just to get a sense for how they respond to certain foods. But I will say that most people, well before they get diagnosed as pre-diabetic or they have a high hemoglobin A1C, which is basically like a 3-month snapshot of where your glucose is, they live with a really high fasting insulin. And this is a blood test that I get on patients in my coaching program, where your glucose can be relatively normal for decades before it gets abnormal. And by that point, you're diabetic. So if you could detect this earlier, but what does go up is checking a fasting insulin. So in other words, if your insulin in a fasted state is high, which is abnormal, that's a sign that you're probably gaining weight because insulin sends the message to store fat. And it's going to be very hard for you to become metabolically healthy, which is having normal triglycerides, normal blood pressure, stable body weight. They say, I think the statistic now is 93% of Americans are metabolically unhealthy, which means only 7% of people have like normal labs when it comes to blood pressure, triglycerides, waist circumference, and blood pressure. So being insulin resistant, I do believe, is contributing to a lot of these problems, but it's getting detected at very late stages. And the popularity of the Ozempic and the Wegovy injections were intended to treat type 2 diabetes, and they still can, although obviously now people are using them for weight loss. I think the best way to treat insulin resistance is to eat a lower carbohydrate diet and avoid the ultra processed foods. That can be completely treated with lifestyle.
Okay, well, that's really important. Tell us about the work you do, how people can find you. You've got some fantastic ebooks. You also have a coaching program. Tell us all about that.
Yeah, I have 2 free ebooks, for the listeners. One is on longevity and wellness, and it gives sort of my top 10 tips for leading a longer, healthier life. And I have another ebook on how to improve your body composition, how to lose fat, gain muscle. And they both can be found. My website, it's williambrunomd.com. And there's a wellness tab there. And under the wellness, you'll find the 2 ebooks. And I have a digital course on wellness and longevity. It's about a 6 or 7 hour recorded content. That's almost like a do-it-yourself, if you will, where you can go through that and create sort of a longevity blueprint for yourself. And then my coaching program is on how to improve your body recomposition, where at the start of the program, we'll run comprehensive blood work on you. I'll send you an Oura ring in the mail to monitor your sleep, because that's how valuable I believe sleep to be. And then we'll get a DEXA scan. The DEXA scan is it's an X-ray that'll tell you your percent body fat, how much muscle mass you have, your bone density, and also the visceral fat. I didn't mention this when we were talking about menopause. There is a fat redistribution that happens in menopause, where the fat that might be traditionally in the hip and thigh area goes more to the abdominal area, or even intra-abdominal, which is called visceral, which means around the organs. So a DEXA scan gives a really good look at that. And then I'll coach patients, meeting with them twice a month. And at the end of 6 months, we repeat the blood work and we repeat the DEXA scan. But what I found is, if you can become healthier metabolically, you will then indirectly look better. And I know I'm in a field where people want to look better via plastic surgery, but through all these lifestyle changes, as a byproduct, you'll look better, and your labs will look better, and your DEXA scan will look better, and so on. So I think there's a lot of interrelationship between the longevity and the aesthetics, but I think most people they're going to look better, feel better, and live longer, which I think is the goal for all of us.
Typically I would ask our guests to give us some tips that someone can wake up and do tomorrow. Really tangible things. But what's really different about your work and your research and your general philosophies are just so integrated in finding a current state of where you're at. You've given us the roadmap for the tests and make the lifestyle changes, and that will change your life and change the quality of your life and change how long you can have a healthy life. It's really rooted in all of that practice, not a quick win of a vitamin B and a vitamin D tablet and do some red light therapy. So really appreciate how you spelled this out for us. And I think you're going to help change a lot of lives. I absolutely hope our listeners, they will find your website and download your ebooks. We can be sure of that. But this has been really wonderful, and I've learned a ton. So thank you for your time.
No, thank you for having me. I appreciate the opportunity, Lara.